Hello everyone, Dr. Tyler Bowersock here from University of Physical Therapy. I'm here to discuss plantar fasciitis or the acute management of plantar fasciitis today with you. First thing, the plantar fascia, if you are a runner, an athlete, or somebody just works on their feet or stands on their feet a lot of times you've had heel pain. And a lot of times this is attributed to your plantar fascia, which is basically a ligament that runs from the heel of your foot all the way to your toes. And it acts as a shock absorber and supports your arch. And so if you're standing, you're running, you're stressing all the time, it can get really irritated and cause you a lot of pain under your heel. And a lot of times it just limits your ability to be up on your feet. So the first thing that we like to do, what we recommend is for people just to simply rest. I know it's a difficult concept for a lot of people, and a lot of people have a hard time doing that, but rest is all relative. So for example, if you're a runner and you're running 20 miles a week, well, you might want to cut that back to, let's say 10 miles a week or less, or find some other substitute some other activities such as the elliptical, swimming, spinning, other low impact activities that would de-stress or take some pressure off that plantar fascia. Other things we like to do in the short term is we like to recommend some other recovery things such as like an arch support. If you get arch support short term, that can take some stress off that plantar fascia and relieve a lot of pain. Thanks to our friends over here at Runabout Sports, they have some different options for you to try out if you need to stop in. Some other things that you may want to do is use like a stick to roll your calf, or even use something like a Theragun to work on the mobility of your calf, as another factor in your plantar fascia being irritated is your calf being a little too tight, which limits motion at your ankle. So a couple of those recovery products are beneficial in terms of helping speed up your recovery. Something else you might want to try is a splint. Sometimes they come in the form of a sock, like a Strasbourg sock, or in this case, a soft splint. And what that does is it pulls your foot back and then pulls your toes back as well. And that actually places a low level long-term stretch on that plantar fascia, which research has shown has been beneficial as well. Again, if you're having plantar fasciitis, you want to rest, get off your feet, or limit the impact on your feet. Make sure you have good fitting shoes, good supportive shoes. You can use an arch support short term to help take some stress off that plantar fascia. You can use some other recovery products like a stick or a Theragun to mobilize your calf, get your calf a little bit more flexible, which makes your ankle a little bit more flexible. Another thing is you can use the sock, the Strasbourg sock, or a night splint, soft splint, which will help stretch that plantar fascia and pull those toes back. So those are some things that you can do early on. I'm going to cast it over to my buddy, Dr. Jordan Lee. He's going to show you a few exercises that you can do to take it to the next step. So get healthy, everybody. Talk to you soon.